turn out the lights and put you all to sleep again.
No, because I will be.
Okay, if we start with the shoulder girdle, the simplest one here, you'll notice that the clavicle, okay, and the scapula are joined here right where the acromion is. Okay, that's the acromioclavicular joint. It's a tendinous type or fibro joint there. That's what you call a shoulder separation when that thing separates with an injury. The clavicle, you need to know it's a clavicle. You should know whether it's a right or left clavicle. You can do that by taking the big knobby end, okay? That's the end that sits on top of the sternum like that on the manubrium. And when you put two of them there, it forms a little notch in the middle. Okay, that's called the jugular notch. That's what you can feel if you stick your finger right there between your two clavicles. Okay? But that knobby end is going to be medial. You take the flat side, and that's the top. Okay? The bottom side has some rough edges, and it has a little lump there called the conoid tubercle. Okay? But the flat side, and it curves to the front. Okay? So this would be a right clavicle. Curves to the front on the flat side out here. So, okay, and there's a few more terms on the scapula than that you need to know. First of all, is it right or left? And how do you determine? It has a flat side as opposed to the side that has this big spine here. Okay, this is the bone you can actually feel on top of your scapula right there. That's the bone right there. Okay, so if you put the flat side on the back, okay, it points to the arm. This would be a left scapula, okay, because here's the joint. Okay. And again, the most prominent feature on here is the big spine here. The end of it is the acromion, okay? And then you have another little finger that sticks off here. This is called the coracoid process. So don't get that confused with the coronoid processes that we're going to have, okay, in the mandible there. Coracoid. It has the coracobrachialis muscle attached to it, and one of your biceps tendons, the two tendons on your biceps, one of them comes up here and attaches to the end of the coracoid here. Okay. The joint itself, this little flat area, is called the glenoid or the glenoid fossa. Okay. That forms a little ball and socket joint with the head of your humerus. Okay. Where it rotates right in there. Primates are pretty special in that we can raise our arms up like this. We can raise our arms out to the side. Think about a horse or a dog or somebody, you can't pull their leg out 90 degrees and raise it up to the side like that because they're built to go forward. But with primates, we got circumduction. We can go in all directions because the acromion is not built so that it keeps that from happening. Okay. Okay. I wouldn't worry too much about the superior angle, the inferior angle, and the medial border or the axillary border, okay? But you do need to know the names of the fossas here, the spaces, okay? Above the spine, there's an important muscle that goes in here. This is called the supraspinatus fossa, okay? And you can guess what this one's called down below. The infraspinatus fossa, right? And underneath, it's not the hypo, but it's the subscapularis fossa, okay? And interestingly enough, the muscles that go in there is the supraspinatus muscle, the infraspinatus muscle, and the subscapularis muscle, okay?
Are these spelled wrong? Supraspin, it says supraspinos, and you said spin.
It must be spelled wrong, yeah.
Supraspinatus.
Supraspinatus.
Okay. Check spelling.
That was redone by a student. It's actually better than the one we used to have. But,
wow.
Okay, so those are the terms. Again, the spine, the acromion, coracoid, the glenoid, the supra, infra, and subscapularis fossa. Okay.
What about the scapular notch?
No, don't worry too much about that. It's right up here. A little notch right there. Okay. Never been on a test. All right, and so now we're working our way down the arm. We come to the long bone here, the humerus. Okay. The humerus has a head, the round part. The little neck right below the head is called the anatomical neck. Okay. This part of the shaft down here is called the surgical neck. Okay. You'll notice that it has two little lumps here on the top. just as your femur does. It has two little lumps. Okay? In this case, these are called tubercles. Okay? And in this case, they're called trochanters. And we'll get to that later, though. In between the tubercle is the intertubercular groove. Okay? It's also called the bicipital groove. Right? This is where the biceps tendon, the other one, the one that doesn't attach to the coracoid, the other one comes up right through that groove and attaches to the top of the glenoid. So that's where the origin of the muscle is. You can see it has a little red streak in there that has been on the test before. Okay. Then you have the shaft. Out to the outside, this is a right humerus. So right out to the side, there's a little rough spot there. That's where the deltoid muscle comes down and attaches to it that raises your arm up. Okay? That's called the deltoid tuberosity. Okay? And then we come down here, it gets a little confusing down here on the bottom. There's little knots and holes here. How do I tell whether this is a right or left? First of all, the easiest way to do it.
The deltoid thing?
Well, you could. Well, that would still give you there. You put the deltoid tuberosity and put it in there. You have to figure out what's front and back on the bottom part, really. That's the easiest way to do it. You see this big dark hole there they've got painted in there? Okay? It's much bigger than the two little holes in front. Okay? So put that big dark hole in the back, and then the head is going to point into the direction of the head. Okay? So that's how you get a right humerus on this one. That hole is there because the ulna has a special little character here. The ulna is going to sit, see that little notch there? Okay? It's going to sit on that condyle, and when you straighten your arm, you can see what's going to happen here. Okay? That, get it right here. There we go. When I straighten my arm, that goes into the hole. Okay? And that, everybody knows what the end of your elbow is called, right?
Funny bone.
Process.
Olecranon. The olecranon. That's the olecranon. Okay? That's the olecranon process of the ulna. So it goes into the olecranon fossa. Okay? And now, the front part of the nose on the ulna, okay, this is the one that's on your little finger side. Okay? The radius is on the thumb side. This is the only. The front part of the notch is called the coronoid process, just like the one in the jaw. Okay, so you now have two coronoids. Okay? The front part is called the coronoid, and that, when you flex your arm, that process goes into a hole in the front. Okay? And so you can guess what the name of that hole is. The coronoid fossa. Okay? So we have the olecranon fossa, the coronoid fossa. The olecranon process, the coronoid process. The notch itself is called the semilunar notch or the trochlear notch. Okay? The trochlea is this part, this little thing that looks like a little spool here. Okay? That's what the ulna is hinging on. Okay? That's the trochlea. And the ulna is a true hinge joint. Okay? It doesn't spin around. And when you rotate your wrist, it looks like all the bones are spinning around. But really, you can hold the ulna still because it can't move. What you're doing is rotating the radius over the top of it, okay? Because this won't move, this won't spin. All this is a hinge, okay? The radius here, this happens to be actually a left radius, but I'll just use it on this one. It has a head, okay, and a shaft. I wouldn't worry about too much else as far as nomenclature, except for this little pointy part here, okay? Because that is, I know this is a left radius, because when I put the flat side up, it's rounded on one side and flat on the other. When I put the flat side up and put it on one, try to put it on one of my arms, that little process has to point to the thumb. Okay? Doesn't work over here. Okay? So it's going to point to the thumb side with the flat side up. So I know this is a left radius. Okay? But the radius, and that little pointy thing now, is called the styloid process, just like the one up by the mastoid. Okay? And the interesting thing is the ulna also has a little point on it, and that's also called the styloid process of the ulna. So we have three sets of styloid processes that you can do. But then right next to the trochlea, this little spool-shaped thing here on the bottom of the humerus, distal humerus, there's a little round condyle here. Okay? That's where the head of the radius sits on and and just rotates on that head. Okay, it just rotates on that ball. That's why I can rotate the muscle or the arm around. Okay, so that's a true pivot joint. Okay, the ulna is a hinge. The head of the radius is a pivot joint. Okay, and that little condyle now has a name as well. That's called the capitulum. Okay, so we have the trochlea and the capitulum, and they're condyles. So the bones that are out here on the sides, all the way out here on the sides, those are called the epicondyles. Okay, so the medial condyle is this knobby little thing right here, which you can feel on the inside of your elbow, that little round knot there, that bone. That's your medial condyle. The lateral, your medial epicondyle. Your lateral epicondyle is on the outside there. Okay, so and so again, head, anatomical neck, greater and lesser tuberosity or tubercle, the bicipital groove or intertubercular groove, the radial tuberosity,
Deltoid
really screwing up, deltoid tuberosity, and then the trochlea, capitulum, the epicondyles, and then the spaces, the coronoid fossa, the radial fossa, where the head of the radius goes in, and then in the back, the olecranon fossa that goes in back here. Okay?
Dr. Erks,
Yeah.
you said that the intertubercular
Intertubercular groove.
groove is the red line going down it?
This one, yeah.
Okay.
Yeah.
Okay.
So it's kind of faint, but it's there.
Okay.
Also called the bicipital groove.
The bicipital groove. Okay.
So that takes care of the ulna and then the radius as well, as far as their nomenclature. The hand, the wrist is what's going to drive you nuts. Okay. I know you can't see it very well. You're just going to have to look at pictures and really sort of memorize these things. But how do I tell that this is a right or left hand? Okay. Well, it has sort of a curvature, so it actually looks like my right hand, right? But you can always tell too if it's out flat. Say if it's one of these things. If it's one of these things, you really can't tell. Okay. What you can look for is a bone right here that sticks up. Okay. That's called the hamate. That's one of the carpal bones, and that little thing is called the hook on the hamate. Okay. That's always on the wrist side, on the palmar side. So if you just point that up, then it'll tell you that's a right hand.
Can you show? Okay, the little
A little thing that sticks up.
that looks like a little process.
Yeah, yeah.
Okay. The
And
hamate.
So now, if I look at it from the palm side here, and if I start, there's 4 bones that are considered the proximal row, okay, and then there's 4 bones that will be the distal row. So there's 8 carpal bones altogether. The first one here on the thumb side, going across, it has 2 names. It's called the scaphoid or the navicular. Okay. The next one is called the lunate, okay, because if you take it out, it actually looks like a little half moon. Okay. Scaphoid, lunate, and then the triquetrum is here, the next one. And then there's one here that looks like a little pea that's sitting off on the side. It's sort of sticking out. Okay. And you'll notice that it's prominent on the wrist like that. If you cock your arm up like this and bang it on the table, you're hitting this bone, and it's called the pisiform. Okay. It gets that name because in Latin, picelli means pea, and it looks like a little pea. Okay. So that's the proximal 4. Okay. Going back to the thumb. Going back to the thumb. The spirits are about to speak. Where the thumb is moving on that bone. Okay, that's the trapezium. You can think of the thumb glides easy on the trapezium. Okay. Because it makes it easier to remember, because the next one is called the trapezoid. Okay, I always got the 2 confused. So trapezium, trapezoid, and then the bigger one in the center is called the capitate. It's named after the capital stone in an arch that holds everything together. Well, that's how it got its name, the capital stone. This is the capitate bone. Okay, and then the last one is the one with the hook. That's the hamate. Okay, so scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Okay. And I've got them lined up here in that order. there's one little mnemonic. Sally left the party to take Kathy home. There's other nastier ones, but the one that everybody learned in my medical school was if you use scaffold, it's some lovers try positions that they can't handle. That's the one I learned. Okay. If you're going to use navicular, then it's new lovers. Okay. So that gets you through the hard part there anyway. Okay. Now you've got the metacarpals, the ones that form the palm of the hand, the longer bones here. These are the metacarpals, numbered 1 starting at the thumb, 1 through 5. Okay. Then you have the phalanges, or the digits, but the bones are called phalanges. Okay. There are 3 in all the fingers. There's only 2 in the thumb. Okay. And these are important joints, especially if you're going into physical therapy or occupational therapy. You're going to get tired of measuring the motion and movement in these things and building splints for them and all sorts of stuff. But you'll be a better expert on the hand than I am after that. Because it's the metacarpals and the phalanges. This is the first one is called the MP joint. Okay. These are condyloid joints that move like this, so I can move my fingers in all kinds of directions. Okay. Okay. So they're condyloid joints. That's what they call them. If you isolate the MP joints, now you've just got hinges. They're not going to spin. They don't have any motion but a hinge. Okay? So the first set of joints there is called the proximal interphalangeal joint, or the PIP joints. Okay? And then the second set is the distal interphalangeal joint, or the DIP joints. Okay? So PIPs and DIPs. Okay? And it works the same way on the toes, the nomenclature. Okay? So that's the end of the upper arm. Now let's talk a little bit about the pelvis and all its goodies.
It was the PIP, what was that?
PIP is proximal, DIP is the distal joint, the end of the finger. Okay? Okay. This is one of your hip bones. Okay? It's called an os coxa. Os meaning osseous, bone, coxa meaning hip, so it's just Latin for hip bone. Is it right or left? Well, I think everybody can figure out that the blade goes on top, right? That's your iliac crest here, okay, for the iliac bone. And then you just put it down. What you're sitting on, what you're actually sitting on, is the ischium, this part of the bone. There's a rough spot on the ischium called the ischial tuberosity. This is where your hamstring muscles all come up and attach to here. Okay, so it's rough, so they can get a hold of it. So ischium is this larger part down here. Ischial tuberosity here. It's broken off a little bit, but there's a spine here. This is called the ischial spine. Okay, and if you look at the whole pelvis, you can see that a little better than this one right here. Okay, these are the ischial spines. Okay, and this is what we were talking about, where you have to be wide enough, to get a baby's head through there, and this is how you can tell if it's a male or female pelvis usually. Okay, so so here's the ischium again. Here's the spine. Above the spine, you see this notch right there. Okay, that's called the sciatic notch, because all the sacral nerves form the sciatic nerve, and then it shoots down through that notch down the back of your leg.
Is that the lesser sciatic?
That's the greater. This is the greater sciatic notch here. The lesser is the one right below the spine. Okay, it's not really even a notch. Okay, but this upper part here is the greater sciatic notch. There. If you see it on just something like this, here it is here. Okay. There's the greater, there's the lesser, there's the spine. The front part is the pubic bone. You have the superior and inferior ramus, the bodies. Okay, and in between, where the two pelvis or the pubic bones attach, you have the pubic symphysis. It's a fibrocartilage joint. Okay, and it's the same kind of joint as the intervertebral joints here, okay, intervertebral disc. They're called symphysis joints, and we'll go over that term on Thursday when we talk about joints. Okay, those are the only 2 sets. You've got all the disc, and then you've got the symphysis here. Those are the only symphysis joints in the body. Okay. So, all right. Now we go to the part of the bone that's called the iliac bone. Okay. When in development, they all sort of come together and form, and all of them will have a little bit of this joint as part of their structure, okay, and then they fuse to form this big joint here. Just like the glenoid and the scapula, it's a real important joint. I guarantee you both, or one of these names is going to show up on the test, okay? This one is called the acetabulum, right? And that's just where the head of the femur sits, okay? Some people will call just this blade part, they'll call it the ala, which means wing, okay? But it's all iliac bone, okay? There's a little sort of a line here that you don't really notice it when you look at the whole pelvis, okay? You see how this line sort of forms, this circle here? Okay? That's called the arcuate line. Below that is considered the true pelvis. Above that is considered the false pelvis.
Pelvis is, where's the true pelvis again?
Down below that line, down inside here. Everything where my hand is true pelvis.
Okay.
So uterus, ovaries, bladder, that kind of stuff, prostate, that would all be in the true pelvis. Okay? Mostly it's intestines just sitting up here, okay? And colon. All right. Now you've got a couple of things on the iliac bone you need to remember. This is the iliac crest, okay? And then you have these two pointy things here in front and two pointy things here in back. Okay? They have names that are pretty logical. We have the anterior superior iliac spine, the anterior inferior iliac spine, okay? The posterior superior iliac spine, and the posterior inferior iliac spine. Okay? So they're named logically. You just have to kind of figure out where they are. Okay? And that's really, except for the big O. The big hole here, this is called the obturator foramen. It's where the obturator muscle, the obturator nerve, the obturator artery, and everything go through here. Okay?
Can you point that this way?
That
The big hole.
right there. The obturator foramen. Okay. Now, working our way down. That was the pelvic girdle. Okay. The acetabulum, the head of the femur sits in the acetabulum. Here's our head. Here's our neck. We don't have an anatomical or surgical neck. We just have a neck on this one. Okay. There is a hole. It looks like it's just been damaged, but there is a little hole in the tip of the head of the femur here called the fovea capitis. And that's where a ligament attaches from the acetabulum and holds on to the head of the femur and holds it into the joint. But it's also where there's an important artery coming out of the pelvis and going into the head of the femur. This is how it gets its blood supply. So when you have injuries, if you break that artery, you dislocate the hip and break that artery, you can have necrosis of the femoral head, and they have to have a hip replacement, okay, if they can't fix it back. Typical for car accidents, you know, you're sitting like this, and the dashboard hits the leg, and it breaks off the back of the acetabulum and dislocates the femur back this way. Okay? So that's the kind of thing that can happen. And you're going to tear that artery.
And does go,
Sorry?
what is that little hole
Called
called?
the fovea capitis. And we talked about two little tubercles, the greater and lesser on the humerus. Now we've got the greater and lesser trochanters on the femur. Okay? There's a intertrochanteric ridge and an intertrochanteric line in the back there, or in the front. Don't worry about that. That never shows up on test, really. Okay, even though it is blue on here. Okay, won't be on my test. We got more important things to test you on. But then you have the shaft. Okay, in the back, and this is the easiest way to tell what's front and back on the femur. You'll notice it is slightly curved toward the front. Okay. But the easiest way, really, is just to look at this rough line right here. This is always in the back. Okay, smooth in the front, and then there's a rough line of bone going down the back. This is called the linea aspera. Okay, the linea aspera, and that has showed up on test already. So.
And that's the rough line in the back.
It's the back.
You'll notice that when you stand, you don't stand like this. Your femur isn't straight up. Okay, to make it level, you actually have a curve like that. So that is level. When you're standing up straight, the femur curves in to your knees. Okay? And what you're standing on there, the These are called condyles. Okay? So we have the lateral on the outside, and this is the joint side, so this would be the medial condyle. Lateral condyle, medial condyle. You've got a big space in between them. Okay? That's called the intercondylar fossa. Okay? The reason that's there is because you have some ligaments that are attaching to the tibia to hold it in place, the cruciate ligaments that we'll talk about next time with joints. Okay? So it's going to sit like this. The round condyles are going to sit on the flat condyles of the tibia, and there is an eminence in between. It's called the intercondylar eminence. When you flex your knee all the way, when you're standing it's not so much of an issue, but when you flex your knee all the way, that eminence goes into the fossa. Okay? So you can see it just rides into the fossa. Okay? All right, that way, it rides into the fossa. Okay? So that's why it's there. And there's just enough room for those ligaments to hold it together in there. So,
Where is the neck?
here.
Okay.
When people talk about getting a hip fracture or, that sort of thing, or broke my pelvis, usually even they're talking about breaking the neck of the femur usually. So, because that's what you fall on. When you feel your hip, you feel that hard part you feel, that's the greater trochanter. Okay? That's a common bursitis, by the way. I used to inject those a lot, people, especially if they just started running
So
or
where's
something.
the lesser
Down
trochanter?
here. Yeah, greater, lesser. This is where your gluteal muscles attach to. Okay, so they pull the leg up and back like that. So they're yanking on it this way. Okay, this lesser trochanter here actually is a connection for that psoas muscle, that big one I showed you on the X-ray coming down your back. It runs down the inguinal canal and attaches to the lesser trochanter in the front. So when it pulls the whole leg up. It's one of the stronger muscles that does that. Okay, it flexes the hip. So I think that'll take care of it. There is something, you can't really see it here, there's a little rough edge here. This is called the adductor tubercle, or tuberosity. Okay? And adduction is when you pull any of the appendages toward the body. So pulling my leg in is adduction. Okay? And all the muscles on the inside of the leg do that. Okay? So they attach here. So if your leg is out, when they constrict, they pull your leg in. Okay? So it's on the medial side. Okay? Now, tibia. How do we figure out whether this is right or left? Okay? You'll notice there's a little bit of a curvature. You have to have that rough spot in the front. This is where your big patellar ligament attaches to the tibia. Okay? From your kneecap, it attaches to that lumpy part of your knee right there. When you kneel down, that's what you're kneeling on, that part right there. You're not kneeling on the joint, you're kneeling on the tibial tuberosity. Okay? And so you put that in the front, and now we still have to kind of figure out, well, is it right or left? You look for this bone right here. The part that sticks down, this forms the inside of your ankle. When you feel that bone on the inside right there, that's what you're feeling. That's called the medial malleolus.
So that's your right leg.
So this would be a right tibia.
Okay. Or yeah, right tibia.
Okay. So it forms the inside of my ankle.
Okay.
Okay. The medial malleolus. Let me grab a fibula here. Okay. Here's the other bone of the lower leg. Don't worry about right or left with this. This is pretty tough. Okay. Just to be able to label it fibula, right? Not ulna or something. Okay. Which I see a lot. So, but this actually forms, little pointy part there, forms the outside of your ankle. You can see how when they come together, they form that U-shaped joint.
Oh, so the both of them together, you'll put your fingers around your ankle, you feel one on one side, one on the other.
Exactly.
Okay.
Exactly.
Okay.
This
So
is
the
the
two-
knob on the outside of your ankle. This is the knob on the inside.
Okay.
And they sit just like that. And the bone, on the talus bone on your foot, sits right up in there and rotates this way.
Huh.
Okay.
So when you break your ankle, you're actually creating a little fracture
Usually
down
break
there?
the knees.
Okay.
Somebody says I broke my ankle. Usually they didn't break any of these bones.
Okay.
What they did, usually they're rotating out like that.
Uh-huh.
That's a lot more common than people rotating in.
Yeah.
Okay, Okay, your foot just wants to go out like that more often, especially if you step on something and roll over on it, you know, like a blade of grass when you're playing baseball.
A blade of grass.
It was more than a blade, it was a lump of grass. But, so here we go. This is our, it's not quite a true hinge because you do get a little bit of rotation in it, okay? But it's mostly a hinge, and you have a lot of ligaments that attach these bones to the talus and the calcaneus there. There's 4 or 5 of them, okay? Usually, if you're rolling out, what this talus does is break off the tip of the fibula. Okay, it breaks off this whole part right here. Occasionally, if it's bad enough, it'll break off the fibula and then crush the other one. Okay, so you break both sides. Okay, that's a typical ankle fracture. Okay,
That would heal.
oh yeah.
Little
But
bones if you
sometimes
take
they'll
it
they'll put a little pin in it sometimes. But you know, if you break it off here, I mean that's a really nasty fracture. You know that's you know you have to get hit by something or fall off a building or something to kind of break that. But if you're just breaking your ankle by running and you know that's what you usually do is break off the fibula. Okay. And I've got some more PBS X-rays and lecture. I'll show you some of the stuff like that.
When people say bow-legged, what would that mean for the bone?
Well, the bones can be bowed,
So it is.
especially with things like rickets. And,
Okay.
yeah, the femur will be bowed out, and the tibia and fibula will
So
be
it would
bowed
come
out.
from both sets of bones,
They'll literally walk like that.
right?
Yeah, yeah. I saw a lot of that in Italy. The old folks, the 80, 90-year-olds who had rickets when they were kids during the war. Okay.
When I was a kid, I had to wear special shoes and braces because I think I was not needing pigeon toes. And they had to correct my bones and my legs. I had to like walk in that thing and sleep in that thing. I hated
That's
that
pretty common. A lot of kids will walk pigeon-toed, and it's called tibial torsion. Very often you just grow out of it. You don't need braces or anything. I had a little bit of that when I was little too.
My
How
daughter
about the ones
did.
that walk like in tippy toes?
That's usually because of the gastrocnemius muscle and the Achilles tendon is too short, so they're walking like that. They can't stretch it out all the way. But, we're at the foot. We're almost done. Okay. So we've already talked about this is where the joint is. Okay. So if you're going to determine whether you have a right or left foot, make sure you put the talus up. Okay, and then you just look where the big toe is. This will be a right foot, right? Okay, that's easy. So the talus is the one on top. The talus sits on the calcaneus, which is your heel bone. Right? Your Achilles tendon attaches back here. Okay? So when I want to get on my toes, it's pulling up and putting me on my toes. Okay? You'll notice that it doesn't quite sit in the center of the calcaneus. It sits off sort of to the side. But there is a shelf underneath that supports it, okay? That's a little bone under here. That's called the talar shelf. It's also called the sustentaculum tali, okay? Comes from the Latin sustentare, to hold up, to sustain, okay? So that
How do you
has,
spell that?
It's not on our list.
yeah, it's on your list.
Yeah, it's right here, right next to calcaneus, pupil.
In the foot bones. So,
Oh, the sustentaculum tal.
Oh,
Yeah,
same
right
thing.
there, yeah.
So that's the little bone that supports the talus.
well, it's part of the calcaneus. It's just a shelf that
Okay,
sticks
it's a
out.
shelf. Okay.
And it breaks off, you know, with the talus coming over this way, you can break that shelf off, okay? This is a nice one because it's all articulated here. Right in front of the talus is another navicular, okay? That first bone there. And then what makes the foot kind of easy is that once you get past the navicular, you've got 1, 2, 3, 4 bones that go across the foot here. Okay, it'd be nice if they were all called the same thing, but the first 3 are. Okay, it's the first, second, and third cuneiform. Okay, and the last one just happens to like its own name, so it's called the cuboid. All right, it looks like a little square anyway. So the foot is a little easier than the wrist. Talus, calcaneus, navicular, 1, 2, 3 cuneiforms, and then cuboid. And then instead of metacarpals, you've got metatarsals, and then you've got the phalanges with the joints named the same way. Okay, so that does it.
All right.
For you. Can you just, so the ankle is the hinge, what other, I mean, the
Well,
tarsal's the hinge and,
you know as well as I do that it's not just a hinge. I mean,
Right.
It's an irregular hinge of anything.
okay. Well, we need to know those other hinges. I mean,
We'll
use that
go
frequently.
over that next time, yeah.
Okay, 'cause we
But
use
we'll
that-
talk, you know, if I want to talk about a hinge, I'll give you a real hinge like this, or like this. you know.
Okay.
I'm not gonna do the hippie one.
Here's the ankle hinge.
Your knee is sometimes called a hinge, okay? But it also has a little bit of movement in it, so some people call it a condyloid joint, or a condyloid hinge.
So, okay, so we'll be discussing then
Joints.
joints and hinges,
Right,
okay?
exactly.
So they're different.
We'll talk about hinge
Okay.
joints. The occipital bone on the atlas, that's a hinge.
Right, you said
Okay.
that, right?
The radial head is a pivot joint.
Okay.
Okay, there is a pivot joint with the axis in the atlas. On the dens, that's considered a pivot joint, even though it doesn't spin.
Right.
Then you've got gliding joints or sliding joints, which would be these. Okay, they just kind of slide a little bit over each other. Okay. Then you've got where the thumb is on the trapezium. That's considered a saddle joint because it goes in different directions. Okay. That's a special joint, a saddle joint for that. The rest of them are gliding joints. Okay. Then you have, like I said, condyloid joints here, hinge joints here. So we'll talk about that kind of stuff on
Dr. Ernst, the patella, are we gonna need to know right in the?
Patella?
Did we talk about that or did I miss it? Right, I mean, right in the.
But it says right over there.
I
I don't
think
even
I
think I
might
can
have
do that.